Hi, Nick. How was school?
It was good. Hey, Mommy, I noticed something different about one of the girls in my class. She's been gone a lot. One time at recess, she showed the scars on her back and arm. She even had a scarf thing wrapped around her head. Lately, she's been wearing a mask like the doctors do and says she can't come play with us anymore.
Has the little girl said anything about why she has been missing school?
Yeah, she said she had something called leukemia. What does that mean, Mommy?
Honey, I think that little girl has cancer. Leukemia is actually a type of cancer that's usually found in children.
Leukemia is a malignant progressive disease in which the bone marrow and other blood-forming organs produce increased numbers of immature or abnormal leukocytes. These suppress the production of normal blood cells, leading to anemia and other symptoms. In 2005, 54,270 people were expected to be diagnosed with leukemia. There are an estimated of 327,520 people living with or in remission from leukemia in the United States. There were more cases of leukemia in males than in females. Leukemia is the 10th most frequently occurring cancer. In every 4 minutes, a person is diagnosed with leukemia. The overall 5-year relative survival rate for leukemia has more than quadrupled since 1960. From 1960 to 1963, the 5-year relative survival rate among whites with leukemia was 14%. From 1975 to 1977, the 5-year survival rate for the total population with leukemia was 34.2%, and from 2004 to 2010, the survival rate was 60.3%. In 2015, 24,450 people are expected to die from leukemia, 14,000 males and 10,000 females. In 2007 to 2011, leukemia was the 5th most common cause of cancer deaths in men and the 6th most common in women in the United States. Every 10 minutes, a person dies from leukemia. Leukemia causes 1/3 of all cancer deaths in children. Factors that may increase your risk of developing some types of leukemia include previous cancer treatments, such as radiation and chemotherapy, genetic disorders, exposure to certain chemicals, smoking, and a family history of leukemia. Doctors can diagnose leukemia using a blood test or bone marrow test. There are 3 primary types of therapies used in treating people with leukemia. Induction therapy kills leukemia cells in the blood and bone marrow to induce remission. Consolidation therapy kills any leukemia cells that may be present even though they do not show up in tests. Maintenance therapy also prevents any remaining leukemia cells from growing. This may be done using lower doses of chemotherapy than those used during induction or consolidation. When there are no signs of leukemia for 5 years, a person is usually considered cured. But if the leukemia doesn't go into remission or if it comes back within the first few years, treatment may include more chemotherapy, a stem cell transplant, or joining a clinical trial for new treatments. Researchers are now studying the causes, diagnosis, supportive care, and treatment of acute myeloid leukemia, AML, at many medical centers, university hospitals, and other institutions. Scientists are making great progresses in understanding how changes in the DNA inside normal bone marrow cells can cause them to develop into leukemia cells. A greater understanding of the genes, regions of the DNA, involved in certain chromosomal translocations or other changes that often occur in AML is providing insight into why these cells become abnormal. As researchers have found more of these changes, it is becoming clear that there are many types of AML. Each of these might have different genes changes that affects how the leukemia will progress and which treatment might be most helpful. Doctors are now learning how to use these changes to help them determine a person's outlook and whether they should receive more or less intensive treatment. In the future, this information may also be used to help develop newer targeted therapies against AML. Progress in understanding the DNA changes in AML cells has already provided highly sensitive tests for detecting the smallest amounts of leukemia left after treatment, minimum residual disease. even when so few leukemia cells are present that they can't be found by routine bone marrow test. For example, the polymerase chain reaction test can identify even very small numbers of AML cells in a sample based on their gene translocation or rearrangement. A PCR test can be useful in determining how completely the treatment has destroyed the AML cells. Doctors are now trying to determine what effect minimal residual disease has on a patient's outlook and how this might affect the need for future or more intensive treatment.
Hey Kate, you're back. How are you feeling? Oh, hi Nick. My mommy found a bone marrow donor for me and I've been doing a lot better since then. I even got a wig to wear until all my hair grows back. I was really scared. I didn't think I'd ever beat cancer. I just really wanted to be able to be a normal kid again. Well, I'm glad you're back. Everyone missed you and was rooting for you. We're glad that you beat that stupid cancer. You're super lucky.
Hi, I'm Katie. I have leukemia, but I'm doing a lot better now since I had a bone marrow transplant. You can help kids like me by donating blood or bone marrow. Help save a life and help fight to end leukemia. Thank you for watching our video brought to you from Penn State Berks campus.